I'm Dr. Ben Newman. I study coronaviruses. I have for a while, over 20 years, and I read a lot of coronavirus papers. Let's use that to answer your questions. Next question is from Saida, who we know. Yeah, hi. Yeah, who I think is in California. Let's see. Our family. Okay, this is a big long thing. Let's summarize. First part is that Saida's saying that her family has relaxed a little bit. They're seeing maybe 10 other families, and the kids are going to the beach and shopping with friends, but within that group. And saying that it's a calculated risk that I think they can live with. Yeah. Ugh. Which I would say I don't know, I don't think there's a scientific explanation to say that that's going to work out well. Yeah, I think the science is on the virus spreading as far and as fast as it can, and yeah, I feel like that's not going to work out. But anyway, at the end there are these four things, and so these are the four basic assumptions, and yeah. If she wants to ask if there's one that I would completely disagree with, yeah, and I think there's two, yeah. So yeah, all right, let's go. Let's see. First one, the virus itself. Virus is less lethal than first assumed. See, yeah. It may be, so that's kind of a personal question. It depends where you're coming from. But there are still people out there that say that this is not as bad as seasonal flu, despite the numbers being, many multiples of the deaths from seasonal flu on roughly similar or even lower amounts of cases. Just crazy bad math, yeah. So the virus is less lethal than we first assumed. I think it is. It's not original SARS. That was more lethal. It's not flu. That was much, 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 much less lethal. It is in the middle. And the fact that it's in the middle leads people to take what I would consider crazy non-precautions and do stuff that is dangerous and leads to the virus spreading. Yeah. And so because of that, I think it ends up being more dangerous than the actual numbers would indicate. Because we're not treating it like something that can kill you 1% of the time. We're treating it like something that isn't ever going to kill you. It only kills other people, and we're operating on that assumption. And there's just nothing else in your life that has a 1% death rate that you would gladly face, over and over again every day. Yeah, just with a smile on your face. That's not a thing. Yeah. Trying to think what the death rate from getting shot would be. Yeah. I guess it depends where you get shot, but it's probably a little higher than COVID-19, but not that much higher. The fatality rates in terms of cases to fatalities are close to 5 to 10% in most places. Probably because we think we're missing a bunch of cases, but those are the numbers. So, yeah. Yeah, I would say it's much worse than most people are acting, but maybe better than it could have been. It's not Ebola. It's just bad enough that we tend to not take it seriously, which drives me absolutely bonkers. Yeah. All right. Research. Point 2. Most likely a vaccine will not be available and distributed within a year. Probably not available and distributed this year before like December, whatever day December ends on. 30 days has to for December 30th. Yeah. But I think from within a year of this date, August to August, yeah, I think there will be vaccines distributed. Don't know how well they work, don't know how long they last, but yeah, somebody will be, because there's too much kind of push to get something out there. And so I think we're going to go with things that are maybe not as effective as they could be, but are safe. Because, yeah, as long as they're safe and they do something, that is helping. So, yeah, I would disagree with that point. But I take your bigger point that, yeah, a vaccine may not be available, and I don't think we can necessarily rely on it, which is why I think we've got to take really strong social precautions in the absence of a vaccine, because the social precautions can work, and then we don't have to wait for the magic of science to try to do something that hasn't ever been done before and make a good coronavirus vaccine. So, all right. Point 3, I super disagree with this one. In terms of people, 70 to 80% will continue to follow the rules, wear masks inside, etc. See limited groups of people, kind of like us. You're in California, and that may be true where you are. My normal trips around places, I don't know. You can go to some places and it's 50%. You can go to some places and it's 10% are following the rules. And that's only usually when there's somebody at the door to shout at you to make sure that you put a mask on. Even sometimes when there is, people will then just like put it on and take it off. I've seen that at Buc-ee's a couple of times. Yeah, even though they put a mask on the darn Buc-ee beaver. Yeah. Buc-ee's is a big gas station with a giant bronze beaver sitting outside smiling at you. That's the selling point. I don't know. And it's got like 100 gas pumps. Yeah. It's like the Disney World of gas stations. If you have not had the privilege and pleasure. Yeah. And more to the point, when I travel in between big cities, nobody wears a mask. Not in the shops, not even all the people that are running the shops. And so, no, overall for the country, it is much, much lower than what you would see in a relatively well kind of regulated and policed big city. So, yeah, I wish that was the case. Things would be better, but yeah, no, it's a mess. It's a mess. Let's see. And response: we will see waves of infection or whatever. Just infection will go up and down in proportion to how many precautions we take and how many risks we take. We're in the risk taking stage right now, and so we're going to go back up. But yeah, we're coming out of a short precaution taking stage, which was nice in that the virus went down a little bit. But yeah, we still haven't built up the will to actually get rid of this thing. Yeah, which again makes me very, very sad. All right, so and all this not overwhelm the system. There was one point at the very beginning where they were worried that they hadn't got tests. They just blew it on the tests. They blew it on contact tracing. Didn't even start. Like hadn't even looked at their homework, and they're right there in class. And at that point, and only that point, flattening the curve makes sense. It is the D minus of public health responses, as I've said before, and so yeah, that was the only time where that logic applies. Now all we're doing is yeah, letting the virus win a little bit at a time and not really stopping it. So that's kind of what it sounds like. That's not the answer you wanted, I'm sure. Yeah. And yeah, I don't know. I don't know what you were hoping I would say, but yeah, it's bad. And honestly, I'm not sure how we get out of this. I mean, how we get out of this is easy. Yeah, the tools are right there. I'm not sure how we come together and find the will to get out of this. Because some people have that will, but there aren't enough to actually move the pile. And so the pile's just sitting there reinfecting itself with coronavirus. That's where we are. Thanks very much. This has been Ask Dr. Ben.